Fred Page. I am doing my cardiothoracic and cardiac and circulation assessment. I'm going to start off with my inspection. I'm going to be inspecting my patient to where he's currently on the table. We're on the sitting, pretending it's a table. He's actually sitting upright. He's comfortable. He's breathing easy. There's no accessory muscles being used, and as well as the posturing is straight up. And looking at his mouth, examining his mouth, there's no discolor of pallor or anything like that. I'm actually doing assessing the front of that, and as well as I'm going to inspect the lateral side of him, and therefore the same thing. It seems to be symmetrical, as well as I'm examining the back of him. There's no anything for us that his posture is straight up. He's breathing easy, as well as no accessory muscles being used, and as well as his posture is straight. So therefore, I'm going to move on to assessment of my respiratory rate. Looking at my respiratory rate, and of course I would count that in a 30-second to a minute. The respiratory rate is symmetrical, therefore, and also to observing the rhythm. The rhythm actually is in sync as well, and as well as the effort. The effort, there's no extra effort for him to breathe easy, and there's no retractions or any use of accessory muscles. Next, I'm going to ask you to, will you lift up your shirt, please? And I'm going to palpate his chest wall. And please let me know if there's any tenderness anywhere. Palpate the chest wall. And there's no sign of any tenderness or any lesions or any pain or any abnormalities. Next, I'm going to have you sit down here, the side of the bed, and have your back to me. And this is where I'm actually going to move to do my thoracic expansion. I'm going to have you lift up your shirt, please. Yeah, raise your shirt up. And here I will actually see the best way I'm going to do this. I'm going to place my hands on both sides of his back. And I'm going to have my hands angled to where, and I'm going to have you take a deep breath in, please, and out. And therefore, it was actually symmetrical. Therefore, it let out, and my hands moved apart equally, and it actually came back down equally degree. So I'm going to have you turn around as well to do the same thing. I'm going to that was the anterior side, so I will move here, have a sit in this chair, please, right here. And I'm still on thoracic expansion, and I'm doing the same thing. I am taking my hands equally, and I'm going to have you take a deep breath in and out. Same thing, the thoracic expansion. Therefore, my hands went up when he took a deep breath, and my thumbs moved apart and at equal degree. And when he exhaled, it actually did the same thing. It came back as equal degree. Next, I'm going to move into my percussion, to where I actually am going to place my hands firmly on the back, and I'm going to have you do the same thing where you sit on the side of the bed, please. Okay, I'm going to have you facing the TV. And what I'm going to do is percussion. I'm going to basically place my hand firmly on his back, pull up his shirt. And what I'm doing is my middle finger here, I'm going to tap. And I will do the same thing over here as well, in out. And I'll move down here as well. Um, okay, that's the anterior side, and I will move to the lateral side. So I'm gonna have you do sit on the side of the bed right here, facing the wall right here. And I will do the same thing at the lateral side. Same thing. And I will actually have you sit in the chair, facing this way. And I will do the same thing. So what I'm gonna have you do is I'm gonna have you take your shirt, if that's okay with you.
Take it off.
Yes, please. And the same thing. Be careful because pacemaker right here. So I'm going to do the same thing. Move over. Okay. That's pretty much the percussion there. So therefore I'm going to do, I did the posterior side, the lateral side, and I actually will have you facing that way, please, with the chair. And I did that side, and I'm going to do this side. Raise your arm for me, please. And I'm going to percuss this side, this other side that I didn't do, which is his right side. Okay. That's how I actually percuss his posterior side, and I did the two lateral sides, and I did the posterior side. I mean, the anterior side. So next I'm going to move to do my auscultation of the breath sounds. I'm going to have you face this way, please. Face that wall. I will start with the anterior side. Listen to his breath sounds. And each time that I place the stethoscope on you, would you please take a deep breath in and let it out, please? I'll tell you what, you can go over with the scoot, stand up for me. Yes, take a few steps forward. All right. Okay. All right. One more. More. Okay. And while you're facing this side, what I'm going to have you do is I'm going to have you face that way for me, please. Yeah, the anterior side, and now I'm going to listen to your breath on the side. So, yep, so right there for me. And raise your arm up like that for me, please. And I'm going to start with the deep breath. One more. Okay. And then I'm going to have you do the same thing. I'm going to have you face that way. And all his breath sounds so far on the anterior side and on the lateral side, on the right side, it's been clear. And do the same thing on his left side. Deep breath. And one more. And one more. And what I'm going to have you do, sit right there on the side of the bed and have you face towards the TV for me. So your back will be facing that way for me, please. And same thing, when I place the stethoscope on your back, will you please take a deep breath? And all his breath sounds, anterior wise, was actually clear as well. Then I'm going to move down to my auscultation of, my inspection of my pericardium. So basically what I'm having you do is I'm going to have you I'm going to have you right here, sit here for me and be facing this way. And next I'm going to do the sites, the 6 sites for the pericardium. I'm going to, right here is, right here, right here is my aortic uh, part. And next is going to be my pulmonic. And then I move down is going to be my herbs. And then right there below the herbs is going to be my tricuspid. And then right here, on the side is going to be mitral. And below there is going to be my epigastric. Those are the spots that actually for the parts that for the pericardium. And those are basically, I'm actually inspecting those, therefore I've actually pointing them out. And therefore, there's nothing evident there. There's anything that's saying that something is wrong. Next, I'm going to have you lay down for me, please. And I'm moving to the palpation of my pericardium. And the pillow on your head, stand up. And next, I'm going to check in for any thrills, heaves, and I will start by, this is the location right here of my PMI. My epical pulse is right here, and therefore I'm going to palpate for any thrills. And then I move over and do the same thing for any heaves. And also too, I'm noting there's no pulsations, anything wrong. To where his heart is beating. Just raising my hand. And then next, while he's actually supined, I actually would do the left lateral side, which is side over here. I'm gonna have you raise your arm for me, please. I'm gonna do the left lateral side. I'm going to listen to the heart sounds here. Well, as far as we'll do supine first. You ready to put your arm down? I'm going to listen to the sounds with the heart located. To start with the diaphragm. Okay, I'm going to start with the aortic and move over to the pulmonic. And that's the herbs. And tricuspid. And move to the mitral, which is right under his left breast. And the epigastric. Okay, and that's the supine. So what I would do is move to where the left lateral. Well, I actually go back, that's the diaphragm. So I go back and listen, go back up and listens with the bell. Gastric. And the mitral. Okay. And go up to the tricuspid. And the herbs. And move to the pulmonic. And the aortic. And we'll note that the S1 sound, S1, S2 sound is actually located upon let's oscillating the heart sounds. And then right here, I'm going to actually move to the left lateral side. Hold your arm up for me, please. Well, actually, I'm gonna go move on to the sitting. I'm gonna have you sit in this chair for me, please. And I will do the same thing. I'm going to listen to his heart sounds. Um, listen to his heart sounds. Starting out with the diaphragm, the aortic, move over to the pulmonic, move down to the herbs and the tricuspid, and the mitral, with the left breast, and epigastric. Then I actually have him laying down again. The next I'll move on to the carotids, the inspection of the carotid, which I'm going to inspect first. The carotid, I will going to inspect. There's no enlargement or anything for us there for the carotid. Basically symmetrical. Then next I'm going to auscultate. I'm going to auscultate before I palpate the carotid artery. So I'm going to take my stethoscope. And now that I expect and I auscultate and I'm going to palpate, I'm going to take 3 fingers. I'm going to lightly press. I'm not going to apply a lot of pressure because I don't want to make it to where it's the lower part of his half of his neck. Palpating the carotid. That is the right side. And I'm going to move over onto the left side. Okay. And then next I'll move over to I'll let you locate his pulses. I'll start with you, hold your hands up like this for me. His radial pulses, I'm going to feel for those. They're right here in his wrist. Okay, down. And I move over to the brachial. There's 1. Okay, and then I'm going to, now that he's sitting, I'll do the popliteal in just a minute. I need him sitting in a chair, but I'm going to do his posterior tibia and his dorsalis. So pull your sock down. So here, this one. Bend your leg for me, please. This way, bend that leg. So therefore, the posterior tibia is like right under here. Right here, like feel it. Yup. Is palpable. Can feel that. And then move up. Locate his dorsalis. Pulse. Okay, same thing. And I'm going to do the same thing with this foot. Dorsalis. Pulse. Okay, right there on his left foot. Dorsalis on top foot. Okay, located it. Then I'm going to have him sit in the chair. I'm going to where you can put your shirt back on. and I will locate the popliteal pulse. I guess I'm going to have you turn the chair around so you can face that way. Yep. And therefore, I will take both hands right here. So you can see both hands right here, and it will be, so I can feel it back here. This will be the back of the knee, the popliteal pulse. Okay, feel it right there. We'll have you do the same thing, face that way so I can see your other knee. I'm going to have bump the chair out a little bit so I can get in front of you. Okay. Same thing, take both of my hands. Locating the popliteal artery behind the knee, the right knee. Okay, let's power up and feel it as well. That concludes my presentation, or actually my assessment for the cardiothoracic and cardiac encirculation. Thank you.